So today, we're going to be talking a little bit about the myths and misconceptions concerning the Control of Tobacco Product and Smoking Bill, otherwise also commonly known as the GEG Bill, which has been presented in Parliament recently. I'm Azrul Mohd Khalib, the head of the Galen Centre for Health and Social Policy, and this is my expert opinion. And the first myth is that banning tobacco will cause huge disruption on the Malaysian economy. So each year, excise taxes or sin taxes collected from tobacco amounts to around 3 to 4 billion annually. For every 1 ringgit collected from the sale of cigarettes, other tobacco products, we are spending 4 ringgit in the treatment of these diseases. And when we are talking about the 4 ringgit, we are talking about direct health costs relating to the treatment of people in hospitals, in providing medication and so forth. This is not counting loss of productivity, the lack of ability to be able to earn an income due to being sick. We are spending easily around 32 billion ringgit each year to deal with the consequences of smoking cigarettes. And if you consider that 32 billion is actually the same amount of this year's health budget, that is what we are spending on the treatment of smoking related diseases, both direct and indirect costs. But think about in terms also of the lives lost due to smoking. And smoking a cigarette is one of the activities that, if done the way it was intended, will kill half of those who smoke. And it is a fact. When you compare to other less desirable compound substances like alcohol, sugar and so forth, if taken in moderation, in small amounts, do not kill 50% of those who take them. But for cigarettes, it is a fact that it kills 50% of smokers. Myth number 2, education is better than a ban. Now, the reality here is that we need both education and a ban. If you look at many of the countries that have been successful in reducing the prevalence of smoking in their populations, such as in Australia, New Zealand, the UK, and in these countries, we find that you cannot have an either-or approach. You can't depend on a ban and see miraculous results overnight. We need to ensure that education is emphasized, that we do not drop the ball in ensuring that people know why it's unhealthy to smoke, and most importantly, to ensure that if there is a ban, that it would be applied fairly and in a transparent manner. The tobacco bill and its provisions are against human rights. The bill, as we see it today, and how it was presented in Parliament recently, it potentially criminalizes the individual smokers and vapers. This is something that we are trying to push back against. It is important to put the burden on the shoulders of retailers, sellers, manufacturers, and distributors. That is how New Zealand is currently doing it. That's how Australia is currently considering. And we are increasingly seeing the effect of that approach. Unfortunately, we have bitter experience from our war on drugs. The war on drugs in Malaysia resulted in thousands of people being incarcerated, imprisoned, punished, whipped due to their addiction and abuse of drugs. There was less emphasis on ensuring that those who are responsible for the manufacturing of these drugs be punished, but instead, thousands of people who are in jail today are users of drugs. Because it is an addiction, it is a medical problem. It is a disease that needs to be treated, not punished. And so we do not see value in punishing individual vapers and smokers due to their addiction to nicotine. But if there is a need to look at penalties and punishments, we really need to consider community service as a real option. The good news is that in the recent parliamentary session, legislators have actually passed a piece of legislation that makes this possible, to allow for the judges to then prescribe therapy or rehabilitation. Everything we do in public health is guided by the framework of human rights, and most importantly, the right to life. The tobacco bill today What it wants to be able to do is to ensure that the human rights of not just the individual, but also the community as a whole, to ensure that when people are vaping or smoking, they do so within the awareness that they may be causing harm to others around them, including their own families, communities, and co-workers. So the next myth is that having this tobacco bill and the bans that come with it will create an illicit tobacco market. I've got news for everyone. If they haven't realized it already, there is an illicit tobacco market today. As high as 4 or 5 out of 10 cigarettes sold in the country being illicit or illegal. Even with a generational ban, there will nevertheless be an illicit market. Because we have to remember that the generational endgame does not apply to current smokers or vapers. They cover only those who are born after 2007. So what needs to happen is that enforcement who are involved, they need to step up. They need to address corruption. They need to be able to meet the organized crime syndicates that are running these illicit markets. So the next myth is that vape is a less harmful product compared to cigarette smoking. Vaping is considered still a harmful activity to indulge in.
All of us have been told that cigarettes have tar, have a lot of chemicals that can be harmful to our body, can lead to cancer. Yeah? But apart from tar, apart from those chemicals, the nicotine substance itself is actually harmful to our body. Our brain have a lot of receptors. Among them is actually a receptor that can bind to the nicotine. So when this prolonged exposure to nicotine is suddenly stopped, patient can develop withdrawal symptoms. Yeah? They have difficulty to focus, mood disorders among teenagers, especially when their brains are actually developing. Vaping, smoking can lead to retardation of brain development. Nicotine have the ability to narrow the blood vessels. It can reduce the oxygen supply to the brain, hence it can lead to stroke. It can cause high blood pressure. It can cause increase in heart rate. The diseases that can be caused by cigarette can actually be caused by vape as well. It's just that the severity of the disease are not really clear because it is still new, hence still lacking of research. Yeah? But so far, a few research have been done which showed that vaping can be as damaging as cigarette.
If you look at it from the perspective of addiction, there is no reduction in the addiction, and therefore the problem continues. We cannot compare ourselves to other countries like in New Zealand and the UK because the vape levels, nicotine strength levels in those countries are different to what we can find here in Malaysia. The maximum that you can get for a vape device is 2% nicotine, which is regulated under law. In Malaysia, we find 5% nicotine. If you exceed more than 6% of nicotine strength that's taken in one sitting by an individual, you can possibly die of nicotine poisoning. So what we are seeing today is actually vape becoming the next addiction device. Today, you find that the tobacco industry are actually moving in. Some of the companies here in Malaysia who are now seeing them being approached by the big players in the tobacco industry and the manufacturers of cigarettes. So they are shifting to the next big thing, ensuring that more people are addicted to nicotine, and that is vape. If you look at the arguments that are being advocated by the tobacco industry and vape industry in Malaysia, they are one and the same. They are similar because they are going for the same thing, which is increasing people's dependency on nicotine. Malaysia has one of the biggest vape industries in the world, worth 3 billion ringgit. It employs around 15,000 workers. And this is something that unfortunately presents an economic challenge for the government. Do you then ban it altogether or do you regulate? And in its wisdom, the government has decided that it would regulate this industry and ensure that it's able to be taxed. Today, we are seeing drag racing being sponsored by vape brands. The same thing that happened in the 60s and 70s with tobacco is now happening with vape. So, Our proposition to the government is this, is that we should treat vape the same way we treat cigarettes, because they are not only the next big thing, they are the big thing today. So, us being Asians, our emphasis is always to punish individuals and to depend on the heavy stick rather than the carrot. But the reality here, based on our experiences in dealing with drugs, with HIV, and many other challenges that have faced, is that whatever we do, it needs to be grounded in the principles and framework of human rights,